This is the Healum patient app. It's been designed for patients who are undergoing treatment in specialist diabetes or obesity and weight management clinics, but it's been designed for clinicians in any clinic that's dealing with chronic disease and chronic illness. It solves for them the fundamental problem of being able to influence, motivate, and understand patients when they're outside of the clinical environment. It's got behaviour change techniques and tools baked into it, it's got monitoring tools baked into it, and it enables the clinician to be able to improve health outcomes and deal with a much larger patient population for a lower cost. The patient sees here, after their first appointment, the goals that have been set between them and the clinician in the app. They're able to, for each goal, look at the plan of action that's been agreed upon, and they're able to then see all of the different things that have been recommended as part of that action plan. They're able to see the conditions that they've identified, and they've got a dashboard here to manage all of their communications with the clinic, whether that be appointments or messages or getting their medical test results through. And if they want to, they're able to add the different wearables and different apps that they currently use to manage their health and to share the data from those apps with their clinicians. Now, on their second ever appointment, instead of going into the clinic, they're able to use the telehealth services to be able to have a much more convenient interaction with their clinicians. They can see the multidisciplinary team that's working to improve their health. They're able to, instead of going into the clinic, have the appointment there from the comfort of their sofa, and they can do that with more than one clinician at the same time. So one of the key aspects that we heard time and time again from patients was that they found it really hard to cut through the noise. So we enabled the clinicians to be able to provide patients with the set of food and all of the exercise requirements over the course of a day for those patients, and to set them challenges. And this is at the heart of the behavioural change techniques. Being able to create group challenges creates powerful social contract and dynamics that hold people to account and motivate them. And it's also important to be able to help people to learn, to understand the different aspects of their conditions, to be able to give them tips for leading healthier lives, whether that be healthier recipes or much more specific medical content. For each of the patients, monitoring is a really key behaviour change technique. Getting that biofeedback helps to build intrinsic motivation, and clinicians can choose the specific set of metrics for specific patient cohorts that will help to best motivate them. And they're able to, for both the clinician and the patient, they can access all of the data in one useful dashboard. We've solved the problem of monitoring food consumption by simply enabling patients to take a photo of their food. So in this case, they can take a picture of the delicious apple. This is then saved to the patient's feed, and that can then be used at the end of a week for the clinicians to get a much better view of what the patient's been eating over the course of the week. We've got all of the metrics on fitness and sleep, which come through wearables, and data on blood tests is supplied through clinical APIs that we integrate with. Each of the biomarkers has an explanation. Patients can compare that with the general population, with their friends. They can take notes around that, and they're able to use this experience to understand how well they're progressing, to keep them motivated, and to be able to inform the clinical team as to how they're doing. Part of the experience for patients is to buy goods and services that will help them to lead healthier and happier lives. And in this case, we can also provide the clinics with a ability to generate revenue from selling products that they know will benefit their patients, such as wearables or supplements, different services, whether they be some nice services to go and have another blood test, or whether they be other content services that the patient might like. So, for the clinics, in summary, this app helps them to deal with more patients at a lower cost and achieve better outcomes through a combination of behavior change techniques and tools such as goal setting, biofeedback, and social contracts, as well as a comprehensive monitoring dashboard that enables them to really monitor and understand patient adherence.